Good morning, dear audience, dear chairs. In the following minutes, I would like to talk you about my PhD topic and the progress of my research. The title of my PhD thesis is The Role of Mental Health Status in Pediatric Inflammatory Bowel Disease. My name is Dávid Horváth. I'm a pediatric gastroenterologist. I am working in Bethesda Children's Hospital, and I'm a first-year PhD student at Semmelweis University. As a pediatric gastroenterologist, in my everyday hospital work, I care also for children with inflammatory bowel disease. So I have a first-hand impression about their lives, the struggles, what they and their family have to face in their everyday life. So my vision is that despite their illness, they will have excellent quality of life. And to achieve that, my mission is to identify every kind of psychological intervention which can help in their quality of life improvement and also which can modify the disease outcome. In this semester, I have started working on 2 projects. One is belonging to the psychological interventions, and another is investigating the effect of mood and anxiety disorders on disease activity. I will present them now. My first project is to investigate the effect of psychological interventions on disease activity and quality of life in pediatric inflammatory bowel disease patients. It is done by a meta-analysis and a systematic review. As for the background, it is important to know that inflammatory bowel disease is increasing worldwide, and 25% of the disease is starting in childhood, which is important because it is a chronic illness, and the childhood and adolescent period is very important regarding to the body image and self-esteem formulation, career development, and social and family functioning. With their illness, these children and adolescents, when they have flare-ups, they can't participate as many social activities they miss from the school, so they don't have the chance to achieve as good academic career and friendships as the others. We have known from a large cohort that the pediatric inflammatory bowel disease, the children with this disease have 50% increased risk of depression, and the youngest the patient, the highest risk of work disability is presented later. Despite these facts, the current guidelines focuses only on the pharmacologic and nutrition support, but there is lack of psychological support guidance. So just a short talk about the psychological interventions. This is a heterogeneous group. There are several types of them. The most frequent used interventions in inflammatory bowel disease are cognitive behavioral therapy, mindfulness-based cognitive therapy, and hypnotherapy. The role of them in the disease course can be in several ways. First, they can enhance quality of life as all other people. And second, they can treat the comorbidity, psychological comorbidities like anxiety and depression. And for third, they can affect through the psychoneuroendocrine immune modulation through anti-inflammatory effect. Our aim is to understand the impact of psychological interventions on disease activity and quality of life in children with IBD. Our clinical question is that these interventions can change the disease activity and quality of life compared to standard care. We put our question in the PICO framework. We will have IBD patients, and the intervention would be standard care with psychological intervention compared to standard care. And we have clinical and also psychological scores with our outcomes. And our hypothesis is that psychological interventions increase also the quality of life and decrease the disease activity in the pediatric IBD patients. If our hypothesis is true, they should be included in the guidelines, and psychological interventions should be advised all the pediatric IBD patients to enhance their quality of life and improve their health. We have done in our preliminary research and we have found key articles for this topic, and we have performed a systematic research, and we have found about 9,000 articles, and after duplicate removal we have 7,000 from that. So we have done the Prospero registration, and now we are on the title abstract selection phases with my co-investigators. Just to move on to my second project, which is investigating the effect of depression and anxiety on disease activity in newly diagnosed pediatric IBD patients. It will be a prospective observational international study. We named it Empathy. It is important to note that the diagnosis of IBD increase the likelihood of facing mental health concerns by itself, but we also know that the depression increase the risk of surgery, the risk of flare, and treatment escalation in adult studies, but we are lack of pediatric data. So our aim is to investigate the effect of mental health status in the clinical course in newly diagnosed pediatric IBD patients. Our question would be that does initial mental health status affect the clinical course of pediatric IBD? And our framework would be PECO for that. We would analyze the newly diagnosed pediatric patients, and the exposure would be depression and anxiety combined score at the diagnosis and also after the induction. And the comparator would be without any sign of depression and anxiety, and our outcomes would be clinical ones. Our hypothesis that the mood and anxiety disorders affect clinical course negatively in pediatric IBD, and if it's true, we would highlight the importance of psychological screening, not only when they have signs of distress or disorders, but at the beginning of their treatment or at the diagnosis, and the need for early intervention is necessary. To sum up my two projects, we plan to finish the first project next year, and the Prospective Observational Study, because it will be we hope that we can involve many international centers. We plan to submit it in 2026. I would like to finish my presentation with a quote from Seneca: "If a man knows not to which port he sails, no wind is favorable." Thank you for your attention.
Regarding to IBD, it is mostly boys or girls, which is more relevant?
It is equal, I can say, in the pediatric population.
No difference.
So both of them is affected.
Okay.
Why did you choose the RCT score for mental health status?
Thank you for your question. We have found that there are many scores and scales for mood disorders, but we found that this is very good and validated, available in many languages, and it's a combined score which can measure both anxiety and depression in one questionnaire. So we hope that it will be more easy to collect the data, and yes, the other thing is that it's available and validated.
I would like to ask you if you can highlight some differences between pediatric and adult onset of IBD.
Thank you for your question. It is important to highlight that if this illness starts in childhood, it can have a more aggressive and more extensive behavior. I mean that it affects a more extensive bowel segment, and progress of the disease can be more severe compared to adults. I mean that these children has a higher proportion to initiate biological therapies and surgery, which could be, in the case of colitis, colectomy, and the other, in Crohn's disease, it could be segmental resection, and other surgical issues are more prevalent in the pediatric population compared to adults.
Do you know if there is any data available on the how depression could affect and the mechanism and the course of the IBDs?
Yes, this is an interesting topic. I would like to highlight in my presentation that there is a kind of bidirectional connection between depression and IBD. We see that the patients with IBD are more proponent or they are more exposed to develop these mental health issues, but from the other side, and there are some data from the molecular background, we see that mainly in depression, but also in anxiety, the elevation of cytokines and inflammatory markers are elevated, and we suppose that this is behind of the risk of developing inflammatory bowel disease if they have genetic susceptibility.
How can the depression influence the IBD?
Yes, it can be influenced by itself. I mean that we can imagine if a patient with depression in a bad mood, they don't take, the compliance of the treatment of IBD is not so good. They don't take their medication, but from the other part, what I mentioned in the previous question, that through this process of the molecular pathways and inflammatory pathways, it can affect by itself the disease course.